to those spring breakers. These are his words, quote, "These kids fly down to places like South Beach for a couple days to party, and they think that's Miami, but they've never seen the real Miami. They've never been to Liberty City. They've never seen the side of the city that's living check to check, the side of the city that's surviving meal to meal. And let me just tell you something, man, there's a Liberty City in every city. It's regular people with regular struggles. And I don't know how I can get everyone to listen, but I say this from the bottom of my heart. The people growing up in the real Miami, they're as vulnerable during this crisis as anybody. And I'll tell you one more thing. This idea about those people that because of this coronavirus, they're going to go hungry, they were already hungry. Way before all this, they were already worrying about where their next meal was going to come from, or where they're going to sleep tonight, or how they're going to get their next dollar. And that's what I need to get off my chest right now, he said. Get off my chest right here, because it's been eating me up to see all this coverage of our city from all these people who don't even know what they're talking about, that's just focused on a bunch of kids acting stupid." And he goes on to point out that for too many kids, school is the one place where they feel safe. And all of that is upended right now. So I want to bring in my next guest on this topic. She knows exactly the impact that all of this is having on children who are victims of child abuse. Rebecca Cooper is the national spokesperson for the Child Help National Child Abuse Hotline. And Rebecca, thank you so much for joining us on this topic. I know that your call volume has jumped by 20%. Texts to the hotline have gone up more than 400% compared to this time last year. I think we should put that in context. It was this time last year, it was a new text program, but that's still part of the increase you're seeing. What are you hearing from children?
So we're hearing from a wide range of callers. Our phone calls are up 20%, but as you said, we're especially seeing a jump in both text and online chat. We became the first national crisis hotline to provide texting and online chat, and that is one of the reasons why we've seen an increase from last year. But a 400% increase in texts from last year is significant, and we are hearing everything from people contacting us about actual abuse that is occurring as a direct result of pandemic anxiety, children having to be home with abusers rather than at school. We're also having survivors reach out to us because this is triggering anxiety and they need someone to talk to. And we have master's level counselors that are available 24/7, and we've increased the number of shifts that people are taking. So our staff has been incredible. We not only operate the national hotline for child abuse, but we're one of the largest nonprofits in the country, operating several programs across the country. We have residential treatment programs where some of the most severely abused children are living to heal. And we have advocacy centers where children go in when they need to be investigated for a case of abuse. And our staff has stepped up because we've had to change business as usual. Need has gone up.
Yeah. And as you said, they are still working. That's very important. They're taking precautions, but they're still working. So if a child gets in touch, they're more likely to use text, or a concerned person gets in touch, they call your hotline. Then what are the resources? How are they different in this situation where, those kids maybe don't have exposure to the mandated reporters like teachers and the like? What happens then for those kids?
Right. So we still follow the standard protocol that we always follow, which is we immediately have them contact 911 if abuse is happening at the moment, Child and Family Protective Services in their city, in their county, in their state. If something is happening while they're contacting us, if they need counseling, then we can stay on the phone with them for longer periods of time. And our counselors can also help parents that are experiencing anxiety. I'll give you one example. We've had parents reach out to us. We had a survivor of abuse reach out to us. Her baby was crying and she got anxious about her baby crying and was afraid she was going to shake her baby and abuse her baby. And our counselor stayed on the phone with her for an hour, literally teaching her how to stay calm in the moment, how to rock the baby, do all those things that we can do because that's why we're here. And 911 can't provide those kinds of resources. And right now they're stretched. So for example, We got notification yesterday that Cincinnati 911 is now alerting their police department that they are only to go to in-house responses in the most urgent situations. So, for example, if someone calls 911 in Cincinnati for an assault, they will still respond, but they will only do a home response if the abuser is on premise or if the person needs immediate medical attention. So we can help absorb and still be the bridge for any of those kinds of local resources that may be stretched to capacity right now. We're increasing our capacity.
And it's such important work, Rebecca. I'm sorry to cut you off, but I want to get the phone number in there. 1-800-4-A-CHILD. That is the hotline to call the child.
And Brianna,
the child abuse
really
hotline.
Hoping we can get some additional help from Congress as well. So thank you for letting us talk about this.
Yes, this is so important, Rebecca Cooper. Thank you.